Let's go forward. This is now chapter 37, 8, and 9. This is week 4. Yes, it's a lot of information, but let's break it down in just to a bunch of concepts that we can work with. Where is my 1 second? So who wants to win today? I know nobody's gone and look at any information. I get it. You have an exam. So this is going to be like a first review, but I'm going to make it understandable for you that you can, even with no prep or minimal prep, can be able to understand these concepts here. Let's just get it going. Week 4. It's all about the variations is the big part of this week. But there's a little more too. Early detection of a hearing impairment is critical, which is of primary importance. So in children, when you think about hearing, what does hearing affect, right? If you can't hear, what's going to be the difference? It's going to make a difference in many different areas of your life, but it's all of them are involved with your speech. If you're talking, you don't never heard the words, you're not going to pronunciate it well. Ever have a person that you've met that's hard of hearing, they'll either talk louder or the way they pronunciate words is not going to be clear. And it's all because of hearing. So, have a problem. They're telling you the child is a problem with speech. Number one, check the hearing, right? Speech, hearing, they go together. A multi. Toddler's playing outside and gets a laceration on the forearm and he needs stitches. What can make this easier? So, toddlers, ages 1 to 3, and they don't like needles, right? Stitches are needles. So, what can we do to make this child's experience easier? And this is things I had to do on a daily basis working in the emergency room. So, number one, when you have a cut, laceration requiring sutures, put some numbing cream on it. They've got great ones out there. Every hospital has their own brand name, but it's a numbing cream. Put it on there and make sure it's on long enough so that it does work. Another thing is that distraction. Now, have you heard of child life? What they are? Child life came into my world in about 2009, 2010. And I was working in the emergency room, and all of a sudden, somebody was in the rooms and they were talking to my children, my patients. And I'm like, well, what's going on? And they explained who they were. Child life are extremely well educated individuals. The minimum degree they have is a bachelor's degree up to a doctoral degree, and they're taught how to play with children on their developmental level. So basically, they're your educator. They can come in, and what they'll do is things like, all right, you got an IV that needs to be started. They're going to show you the tourniquet and the arm board or the tape, or maybe the little plastic tube that's going to be left there, or maybe it's the numbing thing. They're going to show you what it is, sounds made. And when these children are, number one, taught, they do better. And so these people have bubbles on them. They have iPads, games loaded up. And what they can do is get the child's mind away from what you need to do. They're taught what's going to happen, and then you distract them so they don't worry about it. Child life, a great thing. Distraction is perfect for a toddler. A parent recognizes that their toddler has a speech delay compared to their older siblings. What's your priority? What do you think needs to be done? Again, remember speech and hearing hand in hand. You can't hear, your speech isn't going to be good. Your speech isn't good, check the hearing. Always hearing, speech, hand in hand, okay? You don't need to do all this other stuff yet. We need to do is see, can they hear first? Maybe there's wax in their ears. And sometimes that is what is the hearing impediment. Okay. What are signs of an early indicator of impaired cognition? So your child doesn't think the way they should, they're cognitively delayed. What are you going to see? Well, impaired cognition means they can't think, they can't figure things out. So they are going to not be able to do that voluntary grasp on schedule. Okay. And by 7 months, they should be doing crude pincer grasp, right? So that is a delay. Another thing is they're not going to be as verbal as a child who does have impaired cognition. And then why do you think behavior difficulties? If you're a young child and you can't express what you need or want, you're gonna get frustrated and you're gonna scream, yell, throw things around because you cannot communicate the way you should. So we expect that. A child's being treated for a fever. The reason for treating the child's fever is what? Why do we give acetaminophen and ibuprofen to children with a fever? This is a question that I always ask because we don't have to medicate a fever. Once you have a fever, actually your chances of seizures go down like to nothing. It's when you have no fever and 30 minutes later you have a high fever, 101. That rate of rise, that change quick, creates the brain to go synapse, spark, and that's febrile seizures. Okay. Once you have a fever, those febrile seizures, you're not going to have them. Now, so then why do we treat it? Well, how do you feel when you have a fever? You feel icky, right? What do children feel like? They're going to sit in the corner, not want to eat, not don't want to drink, and don't want to play. And fever needs what? Extra fluids. So give them something for their fever, acetaminophen, ibuprofen. 30 minutes later, this kid's up running around. And the most important part, they're eating and drinking. You need to have that fluids going in. Okay. So it's because you don't feel good. It's the aches and pains of fever. Why? Not because of any other life threatening or anything. It's only relief of that discomfort. A multi. A child's complaining of something is in their eye, causing them tearing and pain. What do you do? So if there's something in the eye, number one, you're going to look, right? If it's floating, you could take a tissue and get it out. If something is stuck in there, you leave it alone. You pull it out and you could cause more damage to that eye, okay? Another thing is, does the pupil still react to light? Very important thing. Does the eye still work, right? So to something, it's stuck in the eye. All right. Yes, the pupil is still working. How do you treat this child? Well, if they're at a doctor's office, or if they're calling on the phone, or whatever those things, take and put what we call a Fox shield on it. It's this hard shield. It's not like a tissue or gauze. So it's sort of rounded and oval. So put it on and it can't touch the eye. It protects the eye and what's ever in there. It's called a Fox shield. Put it on, get them to an pediatric ophthalmologist or pediatric ER. And that's what we do, okay? Separation anxiety and a child hospitalized. Which behavior indicates stage of despair? Now, there are three stages of separation anxiety, and these are things you need to read about and understand. Separation anxiety, the child comes in and screaming and yelling and going crazy because mommy left. And then they sit in the corner and they get regressed, maybe sucking their finger, maybe, need a diaper when they've been potty trained. And the third stage of despair is, all right, mommy, daddy, or caregiver's been gone. All right, I'm not going to pay attention when they come to see me because they're going to leave again and I don't want to be hurt again. So, three stages. You need to know what those three stages are. Number one, screaming, yelling, crying. Number two, regress. Number three, ignore the parents because they don't want to be hurt again. Okay. A child with a history of abuse. Which therapy explores emotional problems? You know, Children sometimes can't express the way they feel or what's happened, but put them with toys or paper, crayons, they can show you in another way, right? And what is that called? Play therapy. Simple as that. And it basically will tell us. Now, dramatic therapy was something happened, and now you are going to reenact that. Could have been a problem with they didn't like the CAT scan and the noise, or this person, or something in the x ray or the lab. Through dramatic play, we can find out what caused them to have this fear or this event that happened to them. Thing. When can children react to the stress and anxiety of hospitalization? Kids don't want to go to the hospital. They don't want to be without mom and dad. They do not like change, and they don't like other people touching them and telling them what to do, right? So, stress and anxiety, when do you think? Before, during, and after. Before, during, and after. Children have to have a way to release that stress, and it be through that play therapy, finding out what's going on, or it could be just teaching them what to expect so there's no surprises. Again, teaching them what to expect without lying and being honest, or else they're not going to ever believe you again. A multi. An adolescent goes to the ER for treatment without the parents. How do you get consent for treatment? This happens all the time. Teenager shows up. One of the things that your NCLEX loves to do a question or so about is always about, HIPAA and treatment and consent. This is one of the ones that you would, think that they could be asking you a question about. Know that any child that's 18, that's cognitively aware and alert, can sign for their own treatment. Another thing is they show up, they're 15, we can call the parent and we can get a telephone consent. Or if they come in with a helicopter, trauma alert, come in, there's no parents, a physician, two physician signatures will suffice as a consent. And then they'll get the consent as soon as they're able to. But you do know never withhold treatment, right? Another thing, remember, if this is an 18-year-old child, they've signed for their own treatment. If parents show up or call in, they want information, you cannot give it unless that 18-year-old gives permission. That's important there. A child is extremely fearful of hospitalization. What type of play explores this? So that is your dramatic play. That tells you what's going on, what's happening, okay? It has to do with you want to know why they're afraid. Dramatic play is going to help you identify where and how and what made this fear, this stress. When checking the IV in an infant, you notice the tissue around the IV swollen. What do you do first? So, when you notice something is swollen, number one, turn it off. Remember, 10 mLs of fluid on an infant is a heck of a lot different with swelling than it is with an adult. With children, number one, turn it off and then check your IV site. Very good. In helping a child to adapt to a hospitalization experience, the best approach is what? What do we know about kids, young children especially, bringing them into a hospital? Remember, they don't like it. It's a change. They don't want other adults touching them, being around them. So, the best approach. Mom and dad can't be there. The next best thing is that daily routine of when they do things. When do they get bath routine, right? When do they, change their clothes for the day? When do they take naps? What sort of foods? All of those things can do help. Routine, very important. And then the child knows what's coming next. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? And what's the difference between adults and children on this? And you learn this in a health assessment. Well, I would be putting letters, right? Maybe having arrows up and down and sideways, or pictures of animals. Depending on the age of the child, you would use an appropriate chart. That's why they make so many of them. And yes, it's 20 feet. A multi. Nursing care of discharging a child to home. Kids ready to go home. So, why would you only give written instructions to the parents? What if it's a 10-year-old child? Give them a copy too. Then they know what's going on. Of course, any telephone numbers, what do you expect by today, tomorrow, the next day, and then make sure that they'll repeat to you what is the plan of action here? What do they need to watch for? When do they need to go see the doctor? The medications, when do you give them? What to watch for, et cetera, et cetera. And that you get that child home safe. What is a 3-year-old's biggest stressor of being hospitalized? That's right at that toddler preschool, right at that age. Their biggest stress. So the biggest thing is all about separation from parents. Biggest stress. Yes, they have a fear of pain and mutilation of stranger. Yes, they do. But the biggest is when mommy and daddy have to leave. So that's that one. You know, having parents there is the best thing if they can stay. Multi. What is the best way to alleviate the stress and anxiety of a hospitalized child? So the anxiety, and we've always said it's always the routine, parents there, and then nursing, hospital staff explaining to children on their level what's going to go on so they don't get afraid. And the one thing that we've done is we've made their bedside, their beds, their rooms a safe zone. So we don't do invasive procedures in their room. It's their safe place. Okay, there's treatment rooms and other places that we would start IVs or whatever treatment, catheterized, whatever. So a nurse knows the string tied around an infant's wrist, an appropriate nursing intervention. So sometimes you will see cultures have different things. I know if you look at my little necklace right here, and you see this little blue thing sitting here, this is something that a parent gave me, oh, I would say 20 years ago. And in the Hispanic faith, it's what we call a cat's eye, and it wards away evil thoughts or feelings against you. A string, what is it? Well, ask them. What is it? It may be the same thing, and it's something they believe in. And if it doesn't interfere in nursing care, leave it there. Okay? How can a hearing impairment develop? So hearing impairments can be a lot of different things, but one of the things that you don't think about is hearing impairments can develop from things, like loud noises, and it could be something that could be due to all these otitis media and infections. It could be an infection intrautero. All these different things can cause it. Just to know that hearing impairments can develop, and that's why we do hearing tests prior to discharge on all brand new newborns today. Which urine collection method on an infant is most accurate? Think about that. Accurate. Okay, very important thing. If you have an infant, remember their immune system isn't really robust. So little infections could cause sepsis and death on these children. So in infants, this is one and less, especially your really young ones. If you come in and you're complaining of fever or something's going on, you're not going to bag this infant and get a bagged urine because you're going to say, oh, I can bag it. Well, you're gonna get a lot of the tissue, um, from all of the exudate around the penis or in the vagina, and it's accurate. You're getting tissue sample, not urine. So, in an infant, you will always, if you need a accurate urine, you will do a straight calf. It's easier, and it's one time you get a accurate urine, and if it's an infection, you will get what antibiotic to place them on. And again, these children you can't mess with. You can't have them continually get urinary tract infections and not treating them properly because you're not doing an accurate urinalysis. So, if you need accuracy, it is a Foley catheter. If you need a urine, just a regular urine for not a culture, yes, you can bag the child. And if you need just a little routine urinalysis in newborn ICU, every shift you do a glucose and a protein. All you do is take a cotton ball, put it in the diaper, then they urinate on it. You take you put it inside a syringe and push the plunger down and get a couple little drops, and that's all you need for a glucose and a protein on one of those little urine sticks. So did you hear me? 3 types of urinalysis. Most accurate, catheterization. 1, just the urine, you could do a bag. And then number 3, if you just need a little routine testing, a little cotton ball is all you need, okay? Very big concept here. We catheterize them because they're so immunosuppressed and they don't have any system to fight any infections. So it's better to be safe, treat it right the first time. Die. What is the purpose and function of the family? Hmm. Why do we need a family, right? Remember, family is the most important thing. They give them that safe environment. That's where their culture, their values, their beliefs come from. And that's where all that love and hugs and emotional comfort comes from. So very important family. And it's understood who is the family? An adoptive family? Is it a grandmother? Is it an aunt, an uncle? Who is it? That's still their family. The primary goal in caring for the child with cognitive impairment is to what? You have a child who's cognitively impaired. That means they're a little slower in thinking for whatever reason. What is our goal? We say be the best you can be, right? I have seen in my career children cognitively impaired where we used to just get them out of bed, put them in a chair, feed them, change them, put them back in the bed, turn them. And we didn't really do a lot of teaching. Today, young impaired children are given speech, physical, occupational therapy, and given the ability to be able to communicate. I always go back to I was doing clinicals for Fortis at this prescribed pediatric extend care or daycare for children that have extra medical needs. I met a little boy named Jonathan. He was 7 or 8 years old at the time, nonverbal cerebral palsy, who was in a wheelchair. They gave him a little pad and he could talk to me through it. Now, years ago, there was no way for him to talk. Today, he's learning things like colors and shapes and numbers. They didn't do that years before. We are letting these children be the best they can be. Now, you never accept bad behaviors. All of these children knew they couldn't do bad behaviors and they knew what's expected. So, again, cognitive children, cognitive patients, periodly, what is our goal is always for them to be the best they can be. Many infants require oxygen. What type is best tolerated and accurately delivered? Infants, a lot of them were born with something called TTN. It's a little bit wet lungs. The delivery, they didn't squeeze it good enough and there was fluid left, and it's called transient tachypnea of the newborn. And it requires a little bit of oxygen. Now, infants, what do they like? Everything soothing in their mouth. Put this globe around them. It's like little plastic thing. And inside, you have a little monitor and you have oxygen being delivered. And I'm telling you, it's accurate on the amount and percentage. That kid can look around, see a finger in the mouth or pacifier if he likes it, and he's happy. And that's why Oxyhood is one of the best methods of delivery for that young newborn. What is the best practice for school age children with special needs? Years ago, I know that we used to have different buses, we used to have different classrooms, you know, um, and they weren't really mainstreamed. What they say today, and I think one of the best examples is a friend of mine. Daughter was born that had a stroke in her speech center and can't talk, but she's very smart. So what did they do with her? Well, they gave her a pad so she could communicate because she understands everything, but she was integrated into the regular classrooms and became she's not she's a normal child, but she can't speak. But she has a method and a way to speak. Okay, she actually became a spokesperson for muscular dystrophy and all of those sort of programs about special needs children, and she did really well. Regular classrooms. Multi. Collecting a heel stick blood specimen on an infant. So infants, you don't have to stick an anti-tube and get blood on them unless you need coagulopathies, your PT, PTT. Everything else can be drawn, or blood culture too. Everything else can be drawn on a little heel stick. The thing with heel sticks is do it on either side of the heel, never in the middle. If you take that little lancet that's marked newborn, infant on it, even if you put it in the middle, you can hit the bone, that calcaneus bone, cause osteomyelitis. So either side, another thing, if you dilate the blood vessels with a hospital approved heel warmer, hold it down below the heart and easy, very carefully, easy, slow, not firmly, just gently press a little bit. And then there's these little tiny itsy bitsy tubes. Do you know you could do a complete chemical profile in a CBC with 1.2 mLs of blood? That's nothing. Can you imagine? That's all you need. But don't bruise up that heel because it will happen. Referrals for cognitive impairment should occur when you find out a child is just not doing all those growth and developmental things when they should, and they're behind. They're not talking, they're not walking, they're not turning over, lifting their head, grasping stuff. When do you take care of this? Oh, as soon as you figure it out. As soon as you see delays, get that referral in. As soon as you get them, we start some early intervention, speech, physical, occupational therapy, and we can get these kids caught up to be the best they can be. Down's children have frequent upper respiratory infections. Why do you think? We're talking cognitive delayed in this chapter, right? We know cognitive delay number one is Down's children, and then we'll talk about different things with them that we didn't realize as we go through this course. I mean, one of the things is they've got these flat, smush noses, and mucus gets caught and it drips, and it causes the upper respiratory infections. The big tongue, all that stuff, no, it's the nose that catches the mucus there. A multi. What would be included in the care plan of a patient with cognitive moderate cognitive impairment? So, what do you think is most important things? They're delayed. What do you need to do to help them? Make them feel safe, make them feel less stress. So, always that daily schedule, right? Schedule's always the thing. Again, cognitive children need to touch all sorts of texture, hear sounds, lights. They don't like big sounds, they don't like lights and all these things, but you've got to introduce them to them. Also, safe, age appropriate, but developmentally appropriately age appropriate that are safe. Okay. And again, those toys need to teach something. Tell them how to, do something as they are playing. Multi. Autistic children demonstrate which behaviors? They're cognitively delayed. They're autistic. What are you going to see? So, autistic children are cognitively delayed. Number one, you're going to see those language delays, those fine gross motors. Those are going to be delayed. Most of the time, they sit in a corner. They do not like looking at you in the eyes. It's just a thing that they'll always be looking somewhere else, and they're not going to respond to their name. So autistic children are going to have some of the aggression issues. They can't express themselves because of their language delays, but they tend to just sit in the corner and leave me alone and let me just play. A multi. Children with autism have better outcomes if what? So, children with autism, give them a structure. Teach them how to communicate what their needs are. Sometimes it's verbal, sometimes it might be a picture board. And then always, as I said, decrease those unacceptable behaviors. I mean, I had this little boy, he was a down autistic child. That child had been going to this daycare of this where I did the clinicals, where he had been there so long, he would come off the bus because they brought them in. He would come, got his book bag, put his book bag in a cubby, his cubby, sit down in the chair and wait for vital signs. How many autistic Downs children do those things? It's that structured, it's that routine. On the kid, um, they didn't accept him getting up, moving around. No, sit back down. You have to wait. And then, of course, teaching them a way that they can express themselves. A multi. Fragile X, second most common cognitively delayed syndrome. Very similar to Downs. But the problem with Fragile X, there's different facial things that go on. They have big ears and short chins, but they also are very aggressive. And they tend to require medications to keep them calm, psych medications to keep them calm. They're very similar with Downs, except you know their physical deformities are slightly different, but they are more aggressive with same intellectual disability, learning disabilities, all just like your Downs. Causes autism? Don't we wish we knew? Downs syndrome. Usually, boys, we usually figure it out about age 2. We'll have hints before then, but you'd never make a diagnosis before then. There's something they say it's genetics. There's abnormalities. It's unknown. They don't understand it completely. So because of that, they're still working on trying to figure it out. Again, it's just giving them interventions. Ways children with hearing impairments communicate with each other. So this is the other question. Now you have a child, has hearing impairments. We've looked at the hearing, we've looked at speech, we know what's going on. All right. Now we're going to teach them how to communicate. Lip reading, sign language, finger spelling, all of it. I mean, kids that are different languages in the same room, same age, how they communicate and they can play and have a lot of fun. It's just children have that ability to be able to communicate. What is amblyopia? These are some eye conditions, and there's 3 you should know. Amblyopia is one of them. So amblyopia is what we call a lazy eye. Means one of the eyes don't sit forward, it's a little bit crooked to the side. What do we do with amblyopia? It's a muscle. It's weak. So it sort of goes out or in. It doesn't look forward. You think you take care of something that's lazy. Well, you exercise it. How do you exercise it? Cover the good eye and make the bad eye work. And you do this a couple times a day for a certain amount of time, whatever the physician wants you to do. Usually it's every 2 hours, put the patch on the good eye for 30 minutes, and let the eye work. You don't want to overwork it, but just enough. So amblyopia, eye, cover the good one, make it work, strengthen the muscles. How would you help encourage a preschooler to be less apprehensive when taking their vital sign? Preschoolers, ages 3 to 6. So this is the one that you are going to sit there, you're going to talk on their developmental level. You're never going to tell a child that it doesn't hurt. When I know a blood pressure, it hurts me. I'm not going to lie to them. Vital signs with the parents, sitting on their lap could help. 3 to 5 years old, let them play with this stuff. Make it a game. I would always say, "Oh, I bet my last number is gonna be, from 0 to 9. What number do I want? Oh, I like 7. Let's pick number 7. What number do you like? Pick a number." And then you can help a child through this play not be so, stressed and upset and apprehensive. What child may be more stressed when hospitalized? So one of the chapters talks about different sort of admissions, whether you're an ICU admission, an ER admission, an outpatient, and the differences in them, and children, depending on how they're admitted, it's going to depend on how much they're stressed, right? But a child that's going to be stressed is actually that child who already has experiences in the hospital. And maybe something happened. Maybe they started an IV and it hurt them, or some nurse they didn't get along with, or a person or something. Someone who's been in there a lot is going to be more stressed than that high functioning kid that's never been in there before. Make sense? Been there, had bad experience. I'm going to remember that. And kids remember everything. A toddler has a hard time fixating on a single point. The child's eyes cross the midpoint, they cross eye. What does it mean? Put your finger out and put this eye to see it and this eye to see it. Sometimes they can't put both eyes together, and that has to do with depth perception, okay? This wiggling cross-eyed thing is called strabismus, okay? Strabismus, it is that cross-eyed. And then there's nystagmus, and it's just a twitching of the eyes. Those three you need to know. A multi. Safety in administering medications to children include what? One of the biggest things is that Mike's milligrams per kilogram per dose. And it's also making sure that we do double check doses. Children are not 2 Tylenol every 4 to 6 hours. It doesn't work that way. So knowing that you're giving proper doses, and you will always, always, always check a name ban. Don't ask the child, they're not always gonna act you correctly, and you never base medication administration based on a room number. It is the dose is correct, and you check the name band. That makes it safe. Can help the parents to make a baby swallow their medication. This is something working the last 10 years of my career in an emergency room. And I had children of all ages. And of course, they come in, they have a fever, they need to give a dose of whatever. And now this kid who hates medicine, how am I going to make him swallow it? Well, Let me explain the evolution of nursing. Well, number one, what I used to do is I would put it in, and myself, I'd take a deep breath and go in their face, and they swallow it. Well, I can't blow in their face anymore. It's just not infection control proper, right? So I teach the parents. If you take a child who hates medicine, you get it in their mouth and real quick, they don't even know it and they swallow it. It is the best trick. You squirt it in the back of their mouth, they're going to gag, choke, and vomit. If you pinch their cheeks, they still don't swallow. It's the blowing in the face that will make them swallow. And if you put it in food or formula, if it's this much, okay, but not in a whole bottle, not in a whole thing of food or formula, a little bit, because it's the only way you make sure the child got the whole dose. Treatment for amblyopia. Did I tell you you treat that lazy eye with? So you have a bad eye that just doesn't, muscle don't want to work. Cover the good eye and let that guy work and let's strengthen those muscles. Very good. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important? So, what do I mean by an adolescent cognitively impaired? Let's say you have a girl or boy that has Down syndrome, and you've got to be concerned about, well, taking advantage of these children. And there are sick people, and they will. So, what do we need to do? You need to let them know good touch, bad touch, and what to do. It's that well-defined, concrete code of sexual conduct, and it keeps that child safe, right? Say, a child is asking mom about his sibling in the hospital. How can you alleviate stress and fear? Today we're really, really lucky. We have FaceTime and, we can always put two people in the same room from across the world anymore. Many years ago, we didn't have that. So there are things we can do that can help. And sometimes having a child in the hospital, making something for their brother or sister at home, again, is a distraction, right? Make them a card. Also, you have a child coming into the hospital, seeing their brother or sister. If they're going into a situation of ICU or there's monitoring, that child really needs to be prepared for what he's about to see. Okay? Very important. A multi. What are some best practices when a child is in pain? Pain management, big thing. When, how, what, why? What do we do? So what they say is give pain medicine around the clock. Always check. They might need hot packs, cold packs. They might need to be repositioned. Distracting, putting on a movie, give them an iPad, let them play a game, let them color a picture, let them play cards. And then don't make a child get out of bed or do like incentive spirometry with abdominal surgery or other stuff without medicating first. You wouldn't do it to an adult. Don't do it to a child. Make sure they're medicated, and then you get them up out of bed, ambulate up out of bed, and we can get to incentive spirometry. Always remember to take care of that child. They're going to be able to do those things better and prevent side effects like atelectasis and lung problems. Right. Children can be critically ill for long periods. How do you prevent pressure ulcers? And yes, children can get pressure ulcers. Think about what pressure ulcers are. It's usually think of the adults, the elderly. You think about poor nutrition, skin conditions. Well, children can be a long time, and I've seen them on children. So, what's the best thing that we can do? Number one, keep them clean and dry. If there's diapers or underpads, whatever it is, change them frequently. They should be turned. And then rubbing the areas with lotion can also help. Also, that draw sheet, don't just push up on the sheet because you're going to shear skin off of them. Pick them up on a baby blankets are great. I use those draw sheets, pull them up, right? And the other thing is turning them from side to side. I use everything that's in that bed. Pillows, blankets, soft animals, they are the best. Those little beanie babies are good to hold endotracheal tubes. And then the baby can just look at this cute little beanie baby, right? Younger children. Again, use everything, turn, position, and then use those pillows, blankets, etc. And last question, a multi. Young children can be stressed by being in a hospital. How can you decrease the stress? What's number one? I mean, it could be all of these things, but what's number one? I think I've asked it about 5 different ways in this cahoots. Again, parents stay with child. Routine, routine, routine. And then what are those appropriate toys? You don't want something in the bed that, is not appropriate for what's going on with the child. Yeah, we did today. Who won? Cheyenne. Good job, Cheyenne. Number two, Shay. Good job, Shay. Number one, Jerry. Good job, Jerry. You're hard to beat. And Kanaya and Shy. So that's the end of today. Again, I know you want those exam questions and you want those grades back as soon as you can. I'm working on trying to do it as soon as I can for you, so you don't have to wait too long, all right? Knowing that there is nothing that cannot be come back from on this exam, all right? Can I help anybody with anything before we leave? You all have a great evening. Thank you so much.
Bye. Thank you.